Well, good morning, everyone, Excellencies, ladies and gentlemen, dear colleagues. It's a great pleasure for me to welcome you to this conference, which deals with arguably the most important challenge of our day, namely how to reduce the risks of climate change to human health. And the first slide really illustrates the speed at which we need to respond if we're going to keep climate change below 2 degrees warming above pre-industrial levels, which is the level at which most climatologists think we should aim for, because above that the risks of serious harms, extreme events, and potentially catastrophic and irreversible impacts of climate change become much higher. And the slide shows us, if we look at the second semicircles on the slide, you can see that to reach 2 degrees with a 50% probability, we have less than 30 years of current emissions left. And if we're to keep the warming to 1.5 degrees, then we have less than 10 years emissions left. So that just emphasizes the urgency within which we need to act, and the really important role and goal of building on the Paris Climate Agreement. So the recent IPCC report illustrates the effect that rising temperatures and other changes in climate, like changes in precipitation, the increasing risks that would accompany these rising temperatures. And you can see from this slide that as temperatures increase from 1, where we are at the moment, 1.5 to 2, the risks accelerate, and that's shown by the deep red colour in the slides. You can see that in some cases, like coral reef die-off, for example, we're already experiencing those risks. For others, those risks are beginning, but their most intense phase lies some time ahead. But that time is becoming increasingly compressed, and we need, as I say, to respond very quickly. Many of these changes, of course, have very important implications for human health, either direct or indirect. So, for example, as the climate warms, the increasing temperatures, the rising sea levels, the changes in precipitation, the melting of the ice caps, and so on, these have a range of effects on health, which are summarized in this slide. They can change air pollution levels, the distribution of vector-borne diseases like dengue and malaria, the probability, the risks of water-related illnesses, diarrheal diseases, and so on. The effects of allergies can become more common. That includes the effects of increasing carbon dioxide in the atmosphere. The effects, of course, of increasing heat, direct effects, increasing heat-related deaths, and reduction in labour productivity. So it becomes much more difficult for people to work outdoors. And then, of course, these really important effects, such as undernutrition, decreases in crop yield, which will affect many parts of the world that are already at risk because of undernutrition. There's also a category of very indirect effects that are difficult to quantify, but could be really serious in coming decades and are already affecting populations, such as the effects of extreme events, migration, possibly increases in conflict. So you can see that there are a whole array of impacts of climate change on health. And in order to reduce the probability that these will seriously affect health, we will need to put in place effective adaptation mechanisms and also to reduce greenhouse gas emissions as a matter of urgency. In 2017, for example, economic losses from weather events were the highest on record. The total estimated economic losses, according to the recent adaptation gap report, were over $300 billion US, of which a minority were actually insured for. And there's a big adaptation finance gap. Global public finance flows were estimated to be around $23 billion, compared with about $50 billion of the estimated needs. And as we know, of course, very small proportion of these finances are actually directed towards health sector activities. Slightly larger proportion if we look at more intersectoral health-related expenditures, but still vastly under where they should be. But there is also a potential opportunity here, because many of the important health and environmental impacts that are affecting populations' health today are also linked to climate change. And one of those most powerful linkages is with air pollution, which some people have called two sides of the same coin. And the reason for that is that the majority of air pollutants are linked to the sources of greenhouse gases and other short-lived pollutants. Remember that the most important greenhouse gas is, of course, carbon dioxide, which stays up in the atmosphere for a long time. About 20% of it remains up in the atmosphere for 1,000 years or more. But there are also other important climate-active pollutants like methane, which has an average residence time in the atmosphere of 12 years, and very short-lived pollutants like black carbon, which also has important direct effects on human health. So these interlinkages multiply the costs arising from our current dangerous pathway, but they're also an opportunity to amplify the benefits of our actions and catalyse even greater mitigation ambition. And this slide just shows you the results of a very recent piece of work that we've published, which summarises the health benefits, or the co-benefits as they're often called, of decarbonising the world economy. In other words, removing the fossil fuel sources of greenhouse gas emissions and these short-lived climate pollutants, which would also have dramatic effects on air pollution. And we estimated perhaps 3.5 million or more deaths a year could be averted by decarbonising, removing fossil fuels from the world economy. So that's the air pollution deaths that are prevented. Obviously the climate change related deaths would be additional. That's shown on the top part of the slide, and you can see that many of those prevented deaths would occur in Asia, China, India, Europe, parts of the US. If we look at total emissions from human activities, that includes some of the solid fuels that are burnt in households and leak out into the ambient environment, and emissions from agricultural and land use sources, then the number of preventive deaths would be even greater, over 5 million. And that would benefit health in all regions of the world. So in conclusion, there is a major challenge to reduce the very real risks that we see from climate change on human health that could come through multiple pathways. We need to adapt better to those risks as far as we can, and you'll be talking a lot about that over the next couple of days. But we also need to reduce the risk by moving rapidly to a low carbon, low pollution, and health-promoting, health-securing economy. So let me conclude by wishing you every success in your really important deliberations over the next couple of days, and I very much look forward to hearing the outcomes of your meeting. Thank you very much.
Now we have the chance to have Nick watch to a special keynote, to a special 15 keynotes. It's your turn. Yeah.
15 minutes. 15 minutes, and then we have a break, and then I speak again?
No.
And then I have another hour, and then
you can speak at the lunch.
Okay. Hello. My name's Nick. Hello. It should be immediately apparent to all of you that I am Australian. So I apologize. As an Australian, I don't speak any French. I'm very sorry. And the translators will not be able to understand my accent. We've got 15 minutes. We're going to talk very, very quickly, and then we're going to move on to Diarmid, and we're going to have a quick discussion. I really only have 3 things to say. The 3 things that I have to say, it's a framework for how I think about the last 30 years of climate change and how I think about the next 30 years of climate change. My 3 things, and I think we're going to hear this repeated again and again from all of the experts that we hear over the next 2 days. Number 1, the health impacts of climate change, they are unacceptable, they are unequivocal, and everyone is experiencing them around the world today. No one is immune. Number 2, we've known about this for the last 30 years. We've known about this for a little bit longer than that. And for 30 years, we have done nothing. For 30 years we've done nothing. Now that's not to say that there hasn't been fantastic, impressive work from groups like the World Health Organization, from groups like the Red Cross, but that's to say that the scale of the challenge we face, our response has been inadequate. Number 3, just in the last 5 years, probably since we met in Paris, probably since 2015, we have started to see a change. We've started to see a change in some of the areas most important to public health, and it gives me a little bit of a reason for optimism, okay? So, I'm going to move very quickly. I'm going to put a lot of data up on the slides. All of the data that I have here is produced by a group, the Lancet Countdown. It's a collaboration of all of these groups, all of our friends. We agree on nothing, but that's because we're academics. We produce lovely graphs, not like this. This is the graph we saw from Andy. What we do is we take simple graphs and we make them confusing. Well, that. Oof. Okay. Key point number 1, the human symptoms of climate change. They are unequivocal, they are potentially irreversible, and they are affecting the lives of people around the world today. So let's take 3 examples. What do we mean by this? Firstly, let's talk about heat. Let's talk about heat in 2017, not heat in 2100. Let's talk about heat today. An additional 157 million heat wave exposures. People being exposed an additional 157 million times around the world compared to our climatological baseline. That's an extra 18 million just on top of the year before. And when you look at heat around the world and you look at how it overlaps with vulnerable populations, we see a map that looks very similar to the one there on your right. We see that heat doesn't just cause exacerbations of heart failure or kidney disease, but it also decreases our capacity to work, decreases our capacity for some of the most vulnerable in society. 153 billion hours of labor lost as a result of that, additional hours of labor lost as a result of those extremes of heat. It's 1.4% of Pakistan's total labor capacity. It's 7% of India's total labor capacity, total physical labor capacity. We talk about dengue fever, and we've heard a little bit about that earlier this morning. From 1950 through to present day, just up to today, we have seen an 11.1% increase in the vectorial capacity and the transmission of dengue fever through Aedes aegypti. 8.9% for Aedes albopictus. We heard that we expect, and from a study that came out only 2 weeks ago, we expect that to rise up to 2 billion people by 2080. Let's talk about migration. This is an area that I think everyone in this crowd will know much better than I. Migration is complex. The reasons people migrate are complex, and the health impacts of migration are complex. But what we can say, and let's just take a sort of upper and a lower bound. Let's take the upper bound. By the end of the century, we expect, if we continue on a business as usual scenario, we expect 0.4 of a meter of sea level rise, just from thermal expansion, just from the heat expanding the water. If you end up with North Ice Shelf collapse, if you end up with sea ice shelf collapse, you get another 0.6 to 0.8. Now we're talking about 1.2 meters of sea level rise, and there are 1.4 billion people around the world that are currently living within 1.2 meters of the sea level. It's very, very simple. It's obviously far more complex than that, but that's the upper bound. That's the level that we're talking about. And that's why I like this complex diagram, because it reminds me that when we talk about the health impacts of climate change, we don't just talk about heat, and not just dengue fever, and not just migration. We're talking about what happens when a community or a hospital or a whole country is hit by all of these at the same time. And they're hit again and again and again. And it wears away at the resilient capacity of a hospital to respond. And so in response, we haven't done much. In response, at very best, we've kept emissions sort of from skyrocketing. If we look just at the carbon intensity of the energy sector around the entire world, you'll see that the United States, the European Union, they've decreased their emissions very slightly, but you'll see at the same time India, China, many other countries skyrocketing the intensity of their energy systems up. That line there, the dotted blue line, is the global emissions. It's basically remained flat. And as it remains flat, carbon dioxide continues to rise. We've seen 1.6 billion people still without access to electricity, 2.7 billion people relying on unsafe, unclean, and unreliable sources of fuel for their heating, their cooking, their lighting. And we've seen that only 4.8% of total adaptation spend goes to health. Now, given what we've just said about those health impacts, that's unacceptable. Impact, delay, opportunity. Just in the last 5 years, since we had the Paris Agreement, since the build-up to the Paris Agreement, I think we've started to see a shift. And this shift is the reason that I get up in the morning, and it's the reason that I get excited. This is a graph of total coal use around the world. What you'll see is that whilst coal has been slowly decreasing in a number of countries, one country or two countries, skyrocketing. You see that yellow line? That's China. China has been drastically increasing the amount of coal that it consumes up until about 2013. In 2013, China sort of reached a peak and started to decrease. If we follow that trend through, it continues to fall. We now have 47 countries around the world who have unilaterally said, we're not going to invest in coal because it is bad for the climate, but what's more important, it's bad for health. This graph here gives us a depiction of total deaths from air pollution, and if you focus just in on the parts that are shaded there, those are the deaths from air pollution from coal. Around 21% of all air pollution deaths coming from coal-fired power. It's just simply bad for health, it's bad economics, it's bad for the climate. And the fact that we see that inflection from China, that gets me excited. The fact that we see the UK's National Health Service decrease its emissions by 11% while saving £32 billion and increasing the quality of care that it provides for its patients, that gets me excited. The fact that we've seen electric vehicles now reach cost parity with their non-electric counterparts around the world. 10 years ago, we thought that would happen in 2061. It happened last year. Things are starting to accelerate, and they're accelerating in an area that matters immensely for human health. So, impact, delay, optimism. There's one more thing. I want you to remember 4 things. I lied. I'm sorry, I'm Australian, it happens. Whether we transition from climate change as a threat, from climate change as the biggest global health threat of the 21st century, to the response to climate change as this enormous opportunity. It turns out that all of the things we want to do to respond to climate change, they are fantastic. Shut down a coal plant, reduce emissions. Encourage healthier diets, reduce emissions. Build cities around people rather than around cars, and you reduce emissions. Whether we transition from climate change as a threat to the response to climate change as an opportunity is not an economic question. We have the money. In fact, it's cost saving. It's not a financial question. It's not a technological question. It is now entirely a political question. And that is why I'm so excited to see the Red Cross host this fantastic conference. Because we've seen when the going gets tough and when these issues get important, when a group like the Red Cross, when the medical profession stands up and says, that's not good enough for the health of my patients and the health of my country and the health of my world, that's when we start to, together, move mountains. So thank you very much.
Thank you for this inspiring keynote. So now let's go on with our other inspiring speakers. Diarmid CAMPBELL-LENDRUM. We can applaud him.
Yeah.
Yeah.
Bonjour à tous. Je voudrais dire merci au président de la Croix-Rouge française et au président de la Fédération aussi. Avec ces petits mots, je vais arrêter de parler en français. Je crois que c'est clair maintenant, je ne suis pas ni français ni francophone, je suis anglais, en fait européenne pour le moment. Et pour moi, arrêter de parler français est une intervention humanitaire pour la belle langue française. En fait, je vais continuer en anglais. I'll switch to English. I would also like to just make a personal note of how pleased I am to be here, not just on behalf of WHO, but I am British, but I grew up in Fiji, a nation which is continually hit by severe cyclones. And one of my memories is the Red Cross Society being the first actor on the ground helping people whose lives are being devastated by cyclones. My mum was a Red Cross volunteer, so it really is a huge personal honor to be able to speak here at your birthday. So I'll move on and talk about, leading off from what Nick has said, I've always thought of the Red Cross, the Red Crescent, the movement as being an eminently practical organization. The rest of us publish papers, we give speeches, but it's your organization, your movement, which actually does things. So that was the title of the speech. What do we actually do about confronting these massive challenges that Andy Haynes and Nick have just outlined? And they do range from everything from natural disasters or increased frequency of natural disasters, extreme weather events, heat waves, floods, droughts, impacts on food and nutrition. How do we address this massive challenge? What's our agenda? And as Nick has alluded to, we have now, with you, with others, been working for a while on defining what that agenda is. And it has moved a great deal, particularly since the Paris COP in 2015. And after the Paris Climate Change Conference, we, together with the rest of the health community, organized the second of our global conferences on health and climate change in Paris to basically try and agree what is the health agenda, what should mobilize us as a health and humanitarian community. And this year at the last Climate Change Conference, we had the opportunity to present the first ever health report to the UN climate negotiations. And my talk, my brief talk, will just summarize the 7 recommendations that we have made to the climate negotiations. They're the same 7 recommendations we make to everybody now, and all I'm doing here is tailoring them a little bit to what I think is most relevant, probably for your movement. And I'll count them down so you know when I'm about to finish and when you can go and get lunch. And I'll start with hopefully an increasing order of relevance. The first is, of course, we need evidence. We need the kinds of evidence that the Lancet Countdown and we and others have been producing for many years. But we need to make evidence relevant to people. And you in your movement know that better than anybody else. And as WHO, we have taken our global reports. We now produce country reports of the links between climate change and health, telling each country in the world, we're at about 50 now, we're aiming for about 100, what the climate change projections are, what that means for different kinds of health impacts, and also what are the opportunities, for example, to reduce deaths from air pollution at the same time as you address climate change. So the evidence is critically important. The next is connecting up the kinds of discussions that go on in our community with the big climate talk. So it was a fantastic honor to have Laurent Fabius here, the architect of the Paris Agreement, and I think quite informative of him to say, well, there wasn't enough health, there isn't enough health in that agreement. But health is there. Health is on the front page of that agreement. The right to health is on the initial justification for the Paris Agreement, and it was in the original Climate Change Treaty back in 1992. And we also allude to the health, the treaty also alludes to the health benefits that will come from mitigation and adaptation action. So it's not a lot of text, but I think we as a community, and you in particular, are used to doing a lot with little. So that's a big enough entry point, I would say, to say this is not just an environmental treaty, it's not just a development or an energy treaty, that's also a health treaty, it's a humanitarian treaty. The right to health is there, that means our community should be speaking up. We should be taking ownership and getting behind that. The fifth of these has already been alluded to a certain extent, and it's confronting the dangerous myth that we cannot afford to address climate change, that it will cost too much money. In fact, the health voice and the health evidence gives the lie to that. It shows that that is not the case. If we look at the costs of mitigating climate change at a global level, what it would cost to put into place clean energy, cleaner transport systems, and so on, to meet the 2 C target or the 1.5 degree target that, for example, the small island developing states need, yes, it will cost money. But if you look at the health gains that would come from that, and if you choose to put a value on those health gains rather than ignoring them, but putting an economic value, the value of the health gains that you would expect just from reduced levels of air pollution would in fact be larger than it costs us to deal with the climate change crisis. So the recommendation that we make here is that any discussion about economics and climate change needs to include the health dimension and the health benefits. Otherwise, you're ignoring half or a third of the equation. So that has to be absolutely critical to the climate change discourse. I won't go into the details of this. The fourth, number 4 in this list is not expecting governments to do everything. There is a massive amount that can be achieved at the subnational level. And so it was fantastic to have the mayor of Cannes here talking about what they're doing at the subnational level, because now we find that city mayors often have a lot more power, particularly the power to do integrated action, to take care of the environment at the same time as they take care of their local economy and the health of their people. And so we should also be mobilizing subnational actors as well. And that, of course, goes down to the community level where your movement is so important. And this is just one example of that we produce monitoring of levels of air pollution around the world, and we sign up cities to take commitments to act on air pollution for the health of their people at the same time as addressing climate change. So we should be, as other speakers have alluded to, designing cities not around cars, but around people, around bikes, around sustainable transport, clean energy, and so on. And there is now a great appetite at the subnational level, even in certain large countries where the federal government is not committing as much as they should, if anything, on climate change. A large number of subnational actors are springing up to say, well, we're still in, we will do this because it's good for the people in our local communities. So that's that recommendation. The counting down now to number 3, and again, this has been alluded to, there is this massive overlap between the things that we need to do to address climate change and the things that we need to do to address air pollution. There are many other health co-benefits of climate change mitigation as well, but air pollution is the big one. You may or may not be aware that air pollution inside and outside the home kills about 7 million people a year around the world. It is absolutely one of the biggest health risks that we face, and yet the solutions are effectively the same. If you look at where carbon emissions come from, the different sectors on the left, if you look at where the pollutants that kill people come from over on the right, they're basically the same sectors. And so it's by reaching outside of our silos and dealing with these, putting the health voice into policies made by these other sectors that we can really address this problem. So here's one way of illustrating that. These are all of the different sectors contributing to overall greenhouse gas emissions. This is how climate change people think of the problem. This is how we think as health people we should think of the problem. That as we think about how we get down our electricity emissions or our emissions from buildings, we should think about the opportunities that we have to bear down on these really big burdens of disease. Because if we don't, these are the projections of the increase in the contributions of all of these sectors to global greenhouse emissions and to health problems if we don't take control of them. So we propose having the same solutions for climate change as we do for air pollution. So on this slide, any one of those interventions, you should have trouble deciding whether that's a health intervention or a climate change intervention. They're the same interventions. We should be comfortable in promoting these. The last 2 recommendations, and this is one where certainly the movement has an absolutely critical role to play, It's in increasing the resilience of the health of populations and health systems to the impacts of climate change. These examples have already been given before, just from the last weeks, the cyclone in southern Africa and the record-breaking flooding in Iraq and Iran. The Red Cross, Red Crescent movement is always the first on the scene and is absolutely critical. But as our Director General said, we can't expect your movement to keep picking up the pieces for all of the damage that the rest of us are causing to the planet. So as Nick has mentioned, there has been a massive increase in work in this area. This slide shows projects on climate change and health of over $500,000 or more. If I'd showed you this slide 7 or 8 years ago, there would have been nothing on it. We now have a large number of experiences around the world of projects working on health adaptation to climate change, many of them run by us, and several of those in partnership with the Red Cross, Red Crescent movement, and we'd like to do more with you. And they do everything from dealing with concrete interventions, such as making healthcare facilities more resilient to climate change, to early warning systems for infectious diseases of the kind that you've heard about. But we have to go beyond that. We have to think about the whole system. It's not enough just to turn up after the event or deal with individual hospitals. We have to think about how we make the health system as a whole more resilient to the shocks of these extreme events, but the long-term stresses of climate change, so that we actually transform it so we have a better health system than we started with, despite these massive challenges that we're facing. So this is, I won't dwell on this, this is our comprehensive approach to building climate resilience into health systems. We'd be very pleased to work with you on further developing this to make sure it's really relevant at the community level, the last mile where people actually live. But we do have these other issues to deal with as well. A couple of speakers have alluded to the fact that we have a very poor connection between the climate change mechanisms, including the finance mechanisms, and the health mechanisms. So the figures vary a little bit. This one is specifically for international climate finance. That's the climate finance that should be dealing with the most vulnerable populations in the world, those that don't have their own domestic resources, and yet only about 0.5% of all international climate finance currently goes to health projects because we're not connected up enough. So that's another one of our recommendations that we make to everybody. And the final one, which I think is the most important one and the most important for this conference, is actually on the voice of our community and your community on climate change. We do need to tell the story of climate change linked to the story of health. There are many opportunities to do that. As I say, we're signing up cities. The global health community has a global call to action on climate change and health. Health has now been recognized as one of the priorities for the UN Secretary General's Climate Summit in September this year for the first time. And one of the most encouraging things I've seen in the last few years is the mobilization of young people on the streets. It's another thing I'm very proud of. My children strike for climate. I'm one of those parents who is very proud that my children are spending less time in school, more time out on the streets with their friends, agitating for climate. But one of the other parts to that is that in certain parts of the world, they're emphasizing the health message as well. So when they're campaigning for action on climate change, these kids in India are also saying, clean up our air, we're choking on the fumes of basically dirty development. So I think that is a really good example of where we can mobilize our voices, your voices, together behind a common goal. And the reason why your voice is so important is this graph. This is from the UK, but that could be pretty much anywhere in the world. And it's a measure of how trusted different voices are by profession. We're very proud as WHO that our people are over on the left-hand side, but they're your people as well. I would say if somebody asked, would you trust a Red Cross or Red Crescent volunteer, they would be absolutely right over on the left-hand side of the graph as people who obviously care about the health of people and are therefore also mobilized for action on to protect the planet as well. I won't say anything about the right-hand side of the graph other than to say it seems we have exactly the wrong people currently in charge of this problem. So this is my final slide. I think, so out of all the things we can do, all of the things you can do in terms of programming, operations at the country level, I would say that the single biggest thing we can do is just mobilize our voices as a common voice that is clearly absolutely committed to protecting human health, but we can't do that unless we protect the planet at the same time. So thank you very much.
Thank you so much, Diarmid. And now to finish this morning session before lunchtime, I have just one question for you both. So it's a very interesting question. Believe me. So at +2 degrees and beyond, unfortunately, are adaptation strategy still efficient for mankind? Nick?
Not to use the same trick twice, I'll give you three answers, or three things to think about around that. Number one, yes. Number one, adaptation will always be important. Adaptation will always be an essential part of the response to climate change. But number two, there are going to be limits to that adaptation, and the further you get along, 2 degrees, 2.1 degrees, 1.9 degrees, the further you get along, the further you're going to butt up against those technological, those economic limits. September 2017, Hurricane Irma flattened 92% of all infrastructure in St. Martin. I'm sure that's something that's very familiar to this audience. Yes, there was something you could do to respond to that, and there was something you could do around sort of business codes and infrastructure, but not nearly enough to deal with the entirety of the problem. And that is to say that we are already butting up against the limits of adaptation already today. So at 2 degrees, we're gonna blow past that. And number three, we can do both at the same time. Liberia has an electrification rate of 3%. 3% of the country have access to reliable electricity, and they need that for their health systems. Now, you could put a diesel generator in place, but that would be bad for the climate, and it would be bad for air pollution, but it would power the health system, or it would power the local clinic. What you could do instead that would be far better, and what some of the work the WHO does around this, is put solar panels in place. It helps reduce carbon emissions, and it helps adapt to some of those health impacts of climate change and strengthen the health system. So we can do both of those things at the same time.
Thank you, Nils. And Diarmid?
I think the answer is going to cover part of the same ground. I would say if the question is adaptation sufficient, the ultimate answer is no. Adaptation is absolutely critical. And again, to go back to the work of your movement and to things that other panelists have already said, if we were better at dealing with these problems that we already have, if we were better at providing clean water and sanitation to populations, we would have less to worry about from climate change, or they would have less to worry about. If we were able to get malaria control, bed nets and so on, to all of the affected populations in the world, then the increase in the potential transmission from a couple of degrees of warming would be less concerning because these people would be protected. So we need to do all of these things. We need to put into place these interventions. But to follow on from the point that Nick has said, there are absolute limits to how far adaptation can take you. And some of them are just physiological limits. When the temperature goes above a certain level, it is physically unsafe to do any kind of activity outside. And that's why you get these big numbers for decreased potential labor productivity. And there becomes a temperature where you simply cannot go and work the fields in India or to work in an unventilated factory in Bangladesh. You can't even go outside and play football because it's simply too hot. So there are those kinds of limits. But for me, the most striking limit is the one that was alluded to by the representative from the Marshall Islands. Sea level rise, if we do not control greenhouse gas emissions, will wipe out certain countries. That's not well, it costs too much, it doesn't, to save. That is simply unacceptable. That is a moral wrong. So those are the reasons why we need adaptation, but at the same time, we also need to mitigate.
Thank you so much. We can applaud them.